This video actually means a lot to me because I'd like us to discuss customer experience in healthcare centers across Ghana and beyond. Now, the truth is that when we feel unwell or sick, or anybody we care about is unwell, and we take them to hospitals, what we're actually looking for beyond the medical treatment is a level of customer care or customer experience that helps us on our recovery and eventual well-being. Now, the data is showing that that is not always the case. Out of every 10 people that go into public funded healthcare centers in Ghana, less than 3 of them are actually happy with the quality of service they received. We know there's so much going on with medical professionals. You are mostly working under a lot of pressure. You have very limited resources. Your facilities are not always in the greatest possible shape. And some of you are working overtime. So patients are aware of that. However, we are also a nation of very hospitable people. We are a communal group of people. What is important for us today is to say, how do we apply human empathy and simple behaviors in the way we look after our patients? Beyond or apart from the medical treatment that we are giving our patients, how do we add a human touch to make them feel cared for and also help them on their journey to full recovery? The first thing that you can do to help patients feel like you're providing customer service is, when we arrive in medical centers in pain and in despair, in discomfort, please welcome us with kindness and empathy. Okay? Listen to us. Make us feel and know that you are listening and taking note of what we say is bothering us. Because that feeling of being heard allows us to relax. We feel at ease when you introduce yourself. You tell us what you are going to do to us and what is going to happen next. Introducing yourself to your patient is one very simple way that you can enhance the experience in the medical centers. Patients like to know how long they are going to wait for. And quite importantly as well, simple things like a queuing system can help manage the expectations of that patient. So we don't think that somebody who just came is being looked after whilst nobody cares about what we are feeling. When you're talking to patients, try and speak a language that they understand. Moments where we are ill, communication has to be as simple as possible for the patient to feel at ease. Sometimes the medical jargons might be the way you are diagnosing the illness. However, try and speak a language that the patient would easily understand. Sometimes those medical jargons make the patient more anxious because we don't understand what they actually mean, and they can sound quite severe. Let's try and give full information to the customer or the patient as to what the diagnosis is, what it means to them, and what will happen next, and what the process would look like. Giving us information and allowing the patient to be part of the process of their recovery gives them back some control. I've seen situations where, unfortunately, patients are told what is wrong with them when other people are listening. That is not what we like to experience as patients in hospitals. We like some privacy. Take us away somewhere that would make us feel that we are being looked after as individuals. When patients are on admission, most often you might have a call button next to their bed, and they press the call button. The best practice is that somebody responds to that patient within 1 to 3 minutes. Yes, you might not have the solution immediately, but response time, it's so critical to how the customer or the patient is feeling about the service. Come in and assure them, let them know what you have planned to do to help them. And when you give them a timeline, try and live up to that timeline. One of the factors that determine whether patients are happy with the service they receive in a healthcare center is the state of the toilets or washrooms in those medical centers. Let's clean those toilets. Let's get them hygienic, because after all, we're in a medical facility and we are trying to build behaviors of hygiene and cleanliness in our patients as well. I'm sure that we can all do something about it. All we need to focus on is 3 simple words: kindness, politeness, and empathy. That is what the patient is looking for. Yes, thank you for the medical care. We also want to thank you for your customer care.